Lean body mass assessment is important to clinical nutrition so that clinicians can get a better idea of what's going on internally within the patient or if malnutrition might be a factor. Some ways we can assess lean body mass will be discussed in the video, as well as the different biochemical assessment tools to determine protein status.
Okay. Hi Riley, what brings you in today?
Well, I've lost a bunch of weight over the past few months, and my mom just thought I was unhealthy, so she made me come in.
Okay. So what is your current body weight?
I am 125 right now.
Okay, and what are you usually?
I'm usually about like 145 to 150.
Okay. Was this intentional weight loss?
No, I didn't.
Okay. And so have you changed your diet recently or?
Well, a few months ago, like maybe 3 months ago, I stopped eating meat because I heard it was like really bad for you.
Okay.
So I pretty much just eat, plant-based things now.
Okay. And then do you have any past medical history?
No.
Nothing?
No.
Okay.
One modality of protein assessment that can be used is something called the NFPE, or the Nutrition Focused Physical Exam. It is used to analyze the physical body for signs and symptoms of malnourishment. Some protein-focused components of this test include looking at the face and neck, the skin, the nails, hair, and the extremities for signs of protein deficiency or loss of lean muscle mass. This modality is great to help identify signs of malnourishment or protein deficiency so that corrections in terms of diet or other treatment can be made. However, there are a few weaknesses of this exam. First, it is somewhat subjective, so it might not always be accurate. Also, it might not always give indications of the nutritional imbalances until the imbalance becomes more severe. Also, this test cannot be used by itself to make final conclusions on nutritional status. Other evidence is needed to diagnose malnourishment or other diagnoses. Finally, sometimes alterations of the body, such as hair dye or nail polish, can mask evidence of malnourishment.
So I'm going to be doing a nutrition-focused physical exam on you.
What is that?
So I'm just going to be looking at your hair, your skin, and looking for signs of malnourishment or possible lean body mass loss. Is that okay if I just take a look real fast?
Yeah, I guess.
Okay. Alright, I'm just going to look at your hair real fast. Okay. Alright. I'm just going to look here. Okay. And can I look at your nails? Okay. I like your nail polish.
Modality that can be used to assess protein status is called anthropometrics. This area of nutrition assessment uses measurements and calculations to help provide insight into nutrition status of patients. Some of these measurements include waist circumference, waist to hip ratio, skin fold measurements, height, and current weight and usual weight. Calculations include ideal body weight, percent usual body weight, as well as percent weight loss and gain. Also, BMI is included. Lean body mass assessment tools can make anthropometric measurements as well. Anthropometrics are a great way to help identify areas of concern that could indicate nutritional status imbalances such as protein deficiency and significant calorie intakes or deficits. However, anthropometrics only provides limited information on nutritional status. Research has shown that anthropometrics are not a reliable indication of protein stores in the body. Also, other measurements such as biochemical data might be needed to make full judgments on nutritional status of patients.
Riley's height was 5'8", and from that we took her current weight and her usual weight and calculated her ideal body weight range, which she should be between 132 and 155. However, she is only 125, which is significantly under her ideal body weight range. And also, we calculated her usual body weight percent. So Riley had a percent loss of 16%, which is significant because if you lose 7.5% of your body weight over 3 months, that would be an indication that you have lost a significant amount of possibly lean muscle mass and also weight. We got your labs back, and it seems to be that your levels are a little bit off, which might indicate that you have a little bit of lean mass depletion. For example, your creatinine height index was 45%, and so that was moderate depletion of lean body mass. Also, you're in negative nitrogen balance, and your albumin and prealbumin are a little bit low. Also, we did an immunocompetence assessment, and it looks like that's normal. So that means that we can rule out any trauma-related protein loss. So you're good in that area, but we might run some more tests on you just to see what's going on.
Okay, thank you.
Protein assessments have two main compartments, which are somatic and visceral. Somatic relates to the skeletal muscle, while visceral relates to the organs, structural components, and blood proteins, such as those that comprise red blood cells, granulocytes, and lymphocytes. Somatic biochemical assessments are often run in conjunction with anthropometric data to help us better determine someone's protein status. The two biochemical tests that are associated with somatic protein assessment are creatine height index and nitrogen balance. Creatinine height index involves performing a 24-hour urine collection on the patient and then comparing the milligrams of creatinine excreted versus the expected excretion amount. This calculation yields a percentage value that gives us insight into the amount of muscle mass depletion experienced by the patient. Values of 60 to 80% are only considered to be mild depletion, whereas values from 40 to 59% are considered to be moderate depletion, and any value below 40 is characterized as severe depletion. This test gives us insight about muscle mass because creatinine is formed constantly every day by muscle creatine phosphate, a compound which is essential to ATP synthesis. While creatine phosphate is stored in the muscle tissue, creatinine is a byproduct which is removed from circulation via the kidneys. Nitrogen balance is the other biochemical component of somatic protein assessment. Nitrogen balance is used to assess a patient's overall protein status as well as the effectiveness of a prescribed intervention. While it is not as frequently used in acute care patients, it is much more prevalent in critical care, nutrition therapy, and research settings. To calculate someone's nitrogen balance, a dietitian would estimate the patient's 24-hour protein intake and perform a 24-hour urine collection in order to measure the total nitrogen excretion. One limitation of this test would be if the estimation of protein intake was not entirely accurate, making this test more accurate when a patient's diet is strictly monitored and recorded. This may explain why it is not commonly used for acute care patients who may not be able to accurately report their protein intake. In addition to the analysis from the urine collection and protein intake, the equation calls for subtracting 3 or 4 from the resulting number to account for nitrogen loss from fecal excretions, normal skin breakdowns, womb drainage, and non-urea nitrogen. Some more limitations of this test are failure to account for renal impairment, which would skew this number, as well as the inability to properly measure the amount of nitrogen lost from the aforementioned variables. In addition, burns, wounds, diarrhea, and vomiting can also compound the results. However, this test can be very insightful into a person's overall protein status, as a true negative nitrogen balance implies catabolism or inadequate protein intake. In assessing the results of the somatic biochemical tests, we see that our patient is exhibiting moderate lean body mass depletion and a negative nitrogen balance. To gain a better picture of what's going on in her body, her clinical team will need to run visceral protein assessments. Visceral protein assessments are administered by drawing blood from a patient to analyze their serum transport proteins, which are synthesized by the liver. In theory, serum protein values would be impacted by a change in the amino acids necessary for synthesis, thus giving us an idea of changes in visceral protein status. Albumin is one of the most well-known measurements of visceral protein status. However, it is not the best indicator. Research shows that albumin is not a very good indicator of malnutrition, especially in non-inflammatory states such as starvation. Patients with pro-inflammatory diseases typically present with low albumin levels, in addition to patients who are malnourished and suffering from visceral protein depletion. The half-life of albumin is the longest of the serum proteins, at 14 to 20 days, making it a poor tool for acute care patients. Albumin levels can also be impacted by fluid status, dropping with overhydration and increasing with dehydration, which makes it a useful tool when determining a patient's fluid status. Prealbumin is responsible for the transport of thyroxine. Research shows that prealbumin is a much more useful tool for indicating nutritional risk. While it has a short half-life of only 2 days, this allows its levels to be much more indicative of acute changes in a patient's protein status. In one study, prealbumin was shown to be the best biomarker to provide early diagnosis for malnutrition and assessing the effectiveness of interventions. However, it has its drawbacks as well. It is a very expensive test, making it less practical to run routinely. In addition, it is increased by renal disease and decreased by liver disease, making it a poor nutritional biomarker under these conditions. Some research has also shown that it responds too quickly to post-surgical metabolic stress to be accurate in these situations as well. C-reactive protein is a biomarker that is usually only present in states of stress, inflammation, and infection. While CRP levels do not allow us to directly assess a patient's nutrition status, it can help us rule out sources of protein loss other than malnutrition. This has made it an important tool when assessing protein status to help clinicians determine whether the changes in serum levels of other proteins are caused by something other than just malnutrition. An immunocompetence test known as total lymphocyte count, or TLC, is another tool that clinicians use to rule out infection or injury as a cause of altered serum protein levels. Normal TLC results are typically about 4,000 to 11,000 cells. In the presence of infection or injury, the immune response is heightened, resulting in higher counts. Some studies show that in cases of malnutrition, TLC levels are found to be on the lower side, as an adequate protein status is essential for immune function. Therefore, administering a TLC test can not only help us rule out medical problems as a cause of protein loss, but also potentially indicate a depletion in lean body mass related to malnutrition. Results give us more definitive evidence that our patient is malnourished. Low prealbumin and RBP levels in conjunction with a normal CRP level are the best indicator that her lean body mass loss is related to malnutrition.
So I was looking at the new patient Riley today, and it looks like she might have some malnourishment. That was based on the temporal wasting. Also, her nails were a little bit dull looking, but it was a little hard to tell because of the nail polish. She had some bands in her hair. So I don't know if we can look at some more tests for her.
Emily, I'm Molly's associate, and she asked me to run some lean body mass assessments on you.
Like what?
So some examples of these are the DEXA scan. Have you ever heard of DEXA? Okay, it's a dual energy X-ray absorptiometry. It's basically these X-ray beams pass through your body. Like we're gonna do
Is that dangerous?
It's non-invasive. There is a small amount of radiation involved, but it's pretty slight.
Okay.
Yeah. Okay. So, and they're gonna pick up the differences in your tissues. So, your fat mass versus your muscle mass, and bone as well. So we're gonna look at that. And another option would be the CAT scan, if you've heard of that. Yeah, so that's also X-rays. They're measurements taken at different angles, and this is also, so it's a good test to do because it's pretty comprehensive. But the option is MRI, which is similar, and this is 3D images taken of your skeletal muscle and your tissues and other organs. And then the final one is bioimpedance analysis, and this is when electrical currents are measuring the differences in conductivity of your tissues.
What options do you think are best for me?
Well, the best ones are definitely DEXA, CAT scan, or MRI. There are some differences between them, even though they're pretty similar, like different risks and costs. So what are you thinking?
I think we should just do whatever you think is going to be the most comprehensive and get a good look.
Okay, great.
Scans are commonly used in research and in detecting sarcopenia. So for muscle mass, they are very reliable. However, they are hard to obtain. There's a high cost to doing them, a little radiation exposure, but overall they are non-invasive, quick, and reliable tools to measure the three body compartments, fat, tissue, and bone. While similar to DEXA, CAT scans are very limited in practice and very costly. They are typically reserved for radiological departments. There is also considerably more radiation exposure when compared to DEXA scans. However, the benefits to CAT scans are that they are very precise and they allow for quantitative assessment. A major limitation, similar to CAT scans, is the practicality of obtaining an MRI test. Because these are such high-cost exams, MRIs are commonly limited to research and clinical settings. It is important to note that bioimpedance analysis is just a prediction equation. It is not individualized. Because of this, DEXA is the preferred lean assessment test. Out of the emerging technology, ultrasound seems to be the most outstanding. Ultrasounds are advantageous because they are portable and do not expose patients to radiation. However, there is not a reference standard yet for the applied pressure on the probe while taking measurements, so this may need more work until it can be applied in clinical practice.
So I ran the scans on Riley, and I do agree. I think that she definitely has lost a lot of lean muscle mass, and I think that her biochemical data would also, in conjunction with the scans, support this.
Okay, so maybe we should talk to her about eating more protein in her diet